Good evening, ma'am. How you doing?
Good, how are you?
I'm all right. My name is Marcel Richardson. I'm with the OTA department. What's your name?
Alicia.
Alicia. Okay. How old are you, Alicia?
I'm 26.
You're 26. Okay. What's your job? What do you do?
I'm a receptionist at an IV clinic.
Okay. How long you been doing that?
For about 3 years.
3 years. It's a pretty good job.
Yeah, it's a pretty good job. I enjoy it.
That's good. So what brings you in today?
Well, I've been having a little neck pain, some stiffness, soreness, a little bit.
Okay. How long has that been going on?
For about 2 months.
About 2 months. And if you can give me like a pain description, like a pain level, what would you say?
Right now it's about a 4, but on like busy days, if I'm doing a lot of work or a lot of stuff at home, it can get to about an 8.
Okay. So what are some things that gets in the way of you doing work or at home, causing because of your neck?
Yeah, so at work it kind of deters me from focusing because I'm always like rubbing my neck, or I always have to go to the back and just kind of do small stretches because like I can't really stretch as far.
Yeah.
And since I'm always like directing and showing, it's kind of hard. I feel like I have to turn my whole body to show and do stuff at work. And then I have kids at home too, and they always want to play or they want to get my attention.
Yeah.
And I'm always having to like move slow, like I'm in slow motion.
Okay. So it just decreases your ability to like perform or function.
Yes.
Right. Okay. All right. Well, let's see if we can try to help that and give you a couple things to make sure that you feel better in the long term, right? So today I want to talk to you about the TENS unit. So have you ever heard of that?
No, I haven't.
No. So what the TENS unit is, it's a transcutaneous electro-neuromuscular stimulation, right? So pretty much is an adjunct in place of pharmacological methods for pain management, right? So in order to like, excuse me, mitigate and avoid undesirable side effects of opioids, and primarily it's for people that have arthritis or neuropathy, or in your case, neck pain or back pain.
Okay.
Just pain overall, pretty much. And so what you do, you're going to apply it to your skin, and you have either 2 or 4 electrodes, and you can either apply directly on the site of the pain or on the side of the pain, right? Okay, so a little precautions would be to your skin sensitivity, the intensity of the stimulation, right? And then the duration of the treatment. So that would be how long you will apply or keep the TENS unit on the source of the pain, right? So typically you can do this throughout several times a day for 60 minutes. But since you're just getting introduced to it, I would like for you to cut it in half and try to go for like 30 minutes or however long you can tolerate, right? Okay. So, contraindications, are you pregnant?
No, I'm not.
Not pregnant? That's good because it can affect fetal development.
Okay.
You know what I'm saying, right? Do you have any like broken skin or irritated skin in the area?
No, I don't.
Okay, that's good. So, because it can cause infection to the area too when you're using the TENS unit, right? So pretty much, I'm sorry. First you would like to clean the site of the area that you're applying it to, and then you're gonna apply the electrodes like I was telling you earlier, either on the direct source of pain or around the area, right? And then you'll pick a type of sensory stimulation. So that's either the subsensory level, the sensory level, motor, or noxious, right? And let's see, I'm sorry. Like I said, it's very important to take breaks frequently, while you're doing this, because you don't want to overuse this method or this physical aging modality. That's what it is. And you always want to make sure that if you have other certain medical conditions like a defibrillator or a pacemaker, which you don't have none of those, right?
No, I don't.
That's good because it can affect serious health complications as well with that. All right, so Alicia, enough spill about what the TENS units is. Let's go ahead and apply it and see what we can do.
Okay.
Right? So before we get started, are you comfortable sitting up as you are or laying down?
I want to lay down.
You want to lay down? Okay, so lay down on my table here, and you can put your face right here, and I'll get the TENS unit ready. All right.
Do I need to keep my arms up or?
Yeah, you can keep your arms up.
Okay.
That should be fine. And I'm just gonna lay this to the side right here. And as I mentioned before, you always want to make sure that you clean the site before you apply it to decrease infection. Just get a little alcohol. All right. I'm gonna roll back your shirt a little bit. Is that okay?
Yes, that's fine.
So is this in the direct middle of your neck or side, or where? Can you tell me?
It's really all kind of right here.
All right there.
Sometimes it goes right here too. So.
All right. Okay, let's see. So, and like I said, this TENS unit is really easy to apply. I don't know if you had the opportunity to like jump your car off or something like that, but essentially it's like that. Okay. So what you'll do is you'll get these electrodes, these things right here. You can look up for me, man. So you'll get these electrodes, right? And you attach them, the red and black, and then they're really easy to apply. You peel these off, and then here I'll get it a little bit. I'm gonna just go on the outside of the paint source.
Okay.
So I know. So you apply one at the top of the source. And then apply one at the bottom of the source. Tuck that in right there. Okay. Now you don't have to use 4 electrodes, but since you have, some discomfort and a lot of pain causing, we're just gonna go ahead and use 4.
Okay.
And again, when you're at home and stuff like that, just try to make sure the area is clean before you apply, and then seal, tuck these in. Alright, so now I'm gonna cut the device on.
Okay.
Right. So I'm gonna start you at a low level, so 25 hertz
Okay.
should be good enough. And then I'll just keep increasing, and you let me know when that's good enough, okay?
Okay.
All right. How we feeling?
That's good.
Let's go right here.
Yeah.
All right. Now again, I said you can do this for 30 to 60 minutes. But for the time being, since you're visiting me in the occupational therapy, we just want to get you familiar with the physical aging modality, and then we can get you prepared and send you home and make sure you have everything that you need going forward, okay?
Okay.
All right. Now again, please let me know if you have like any discomfort that's going on, and we'll try to stop it so we can fix it and find out what's going on, okay?
Okay.
So what are the things that you do at your job?
Set up certain procedures, or infusions, so.
Okay. That sounds like a pretty cool job. I might have to come visit you someday.
Yeah, it's pretty cool.
All right, Elisa. I think our time is coming up for us to go ahead and check. Is everything still fine? Still good?
Yes.
All right, so let's count down. I have 3, 2, 1. All right, so that's good. I'm gonna go ahead and take these off of you. bad coming off, was it?
No.
So how was your experience doing this for the first time?
It was actually a lot better than I thought it was. I thought it was gonna be a shock, but surprisingly, it was just like a small vibration.
Small vibration?
Yes.
Yeah, that's pretty much what it is. Alright, Miss Alicia, you can go ahead and sit up for me. So, right now, I just want you to, try to get familiar with it. I know I didn't show it to you before I applied it, but this is pretty much what it is. It's battery operated. The brand is called Ultima 5. Your regular standard AA batteries,
Okay.
stuff like that. And it has a little clip if you would like to just, hang it on one of your clothing areas or stuff like that while you're doing stuff. Like I said again, you can do it throughout the day several times, as many times as you want, but you do want to ensure that you take breaks as often as possible too, to avoid overstimulating and then skin irritation.
Okay.
Alright, so I can put this up for you and I can wrap it up and get you on your way. Do you have any questions for me regarding the TENS unit and everything? Are you clear? You understand what it is?
Yeah, I definitely understand. I could do it like maybe starting off like 2, maybe 3 times a week and work my way up to every day.
Yeah.
Okay, yeah. Everything's clear.
Alright. Well, thank you, Miss Alicia. I hope I can see you again. You have a good day, alright?
Thank you so much. You too.
Thank you.